Hello there. We are on your screens once again to talk about one important topic across the globe, that is sexually transmitted infections. In Canada and around the world, the trend is clear. Sexually transmitted infections are on the rise. With the right information, individuals can make informed choices and better protect themselves and their partners from sexually transmitted infections. Often, the only way to detect an infection is through screening. Individuals who suspect they may have been infected should be encouraged to seek medical attention immediately rather than waiting for the onset of visible symptoms. We have a lot of sexually transmitted infections. We have bacterials, we have viral, parasitic, fungal, bacterial vaginosis. Under the bacterial, we have chlamydia, gonorrhea, syphilis. In the viral, we have genital herpes, hepatitis B, HIV, known as human immunodeficiency virus, HPV, that is human papillomavirus. Under the parasitic, we have pubic lice or scabies and trichomoniasis. Fungal, we have candidiasis known as yeast infection. Today, the emphasis is on hepatitis B. Hepatitis B, a vaccine-preventable viral infection that affects the liver. Hepatitis B is a disease that affects the human liver and causes issues to the body. By the end, we should know what hepatitis B is, how hepatitis B is transmitted, the signs and symptoms, consideration and possible complications. Let's dive into it. Hepatitis B is a virus found in blood and body fluids, including the vaginal secretions, semen, breast milk, and saliva of infected individuals. Most infected people, that is 90%, naturally produce antibodies to fight the disease, but some develop chronic hepatitis B. They carry the virus all their lives and are infectious for life. Chronic infection can significantly damage the liver. Most common in developing countries. How can hepatitis B be transmitted? Through oral, vaginal, or anal sex with an infected person. Through exposure to infected blood or blood product. Example, injection drug used with shared equipment, accidental exposure, or needle stick. Occasionally, from contact with shared household items such as razor blades, toothbrushes. During childbirth, that is, if the mother is affected, the mother can transform or transmit the disease to the child. That is transmission from mother to the infant. What are the symptoms and the signs we see? In up to 50% of people, there are no outward signs of infection. Up to 8 weeks after exposure to the virus, some people experience flu-like symptoms including tiredness, nausea and vomiting, decreased appetite, a rash, joint pain, yellowing of the eyes, and skin in rare cases. Consideration and possible complications. All sexual and household contact of people with hepatitis B should be advised to be vaccinated to prevent infections. Chronic hepatitis B can lead to severe liver damage, including cirrhosis, that is, scarring of the liver, and can lead to cancer. Individuals who develop chronic hepatitis B infection require liver functioning monitoring and may benefit from treatment with an interferon or an antiviral medications. Babies born to mothers with hepatitis B are at a high risk of becoming chronic carriers. They should receive an injection of antibodies immediately after birth, followed by the vaccine. With the use of passive antibody, the vaccine, there is an extremely low risk of vertical transmission. People with chronic hepatitis B are to suffer progressive liver disease and liver cancer. This disease, when you are affected, it can't be cured. But, as I said earlier, it's a vaccine preventable. We have a vaccine to protect ourselves from hepatitis B. It's given 3 consecutive times and it protects us against hepatitis B for 10 good years. Run to the nearest facility, nearest healthcare, and be vaccinated against hepatitis B. Liver diseases is real. Liver cancer is real. And death is real. Let's protect ourselves from hepatitis B. Protect our families from hepatitis B. See you next time. Hope it's been useful to you. Thank you for your time.